11:13 is the time, and thank you so much for joining us once again for the COVID-19 health discussion. We want to thank the listeners of DBS Radio, Kyrie FM of Q95, Voice of Life, and Vibes Radio, all for joining us this morning. And our guests in studio this morning from the Health Promotion Unit is the coordinator, Mrs. Mignon Rule Shillingford, and also with us, we have someone who is going to do a lot of enlightenment today on a specific topic that people have been very concerned about. We have Ms. Leslie Ann Waldron, who is part of the Dominica Psychological Society and also works at the Dominica China Friendship Hospital in the psychological unit, so to speak. So we have our two guests. Of course, Ms. Waldron will be speaking on mental health and coping mechanisms as we face this very challenging time. And as usual, Mrs. Shillingford will be talking about everything else because that's what her expertise lies. Everything else. We trust her to give information on everything, including the preventative measures that we've been stressing for the past, what has it been, 4 months or so? So we want to thank you again for joining us. As always, after we do our little, teaching or a little giving out some information, then the phone lines will be open to you for your questions and comments. Before we get to Ms. Waldron, Mrs. Shillingford, we're going to start with you because we've noticed in studio you're not wearing a mask this morning, but there's a specific reason for that. What's the reason?
Of course, it's always nice to be here on the radio, just talking with you, engaging you, just giving you the necessary information as it becomes available. One thing that we promise from the Ministry of Health, Wellness and New Investment, as the information becomes available to us, they are concrete, they are evidence-based, we will be sharing that with you. And today what I'm going to do, first before I start off and continue our discussions, I am going to do a demonstration of how I would put on my mask. Okay, so yes, I'll be wearing mask today, and I know that a number of you now are hearing that we are saying that we would like you to wear your mask if you are going out in the public. Now, before we spoke about only persons who would have signs and symptoms that we would want them to wear their mask because we do not want them to infect the public, we do not want their respiratory droplets to drop on surfaces, and then after we see one of the main modes of transmission is on surfaces, so you cough into or sneeze into your hands, and then you touch surfaces, and then other persons unsuspectingly touches it, and then they touch their points of entry, which is the eye, the nose, and the mouth. However, based on what has been happening, and of course we are seeing this disease, information about this disease, COVID-19 is evolving. And what we are seeing is that there are persons who may be carriers of the COVID-19 and may not show signs and symptoms. So why we are asking you now to wear your mask when you go out is for you to protect the public, for you to protect the public, and now the public to also protect you. Okay, so in the event that you may be a carrier and you may not be presenting the signs and symptoms, we do not want you to spread the virus. So that is why now that we are asking you to wear your mask. However, there are some things that you must take into consideration when wearing masks. For one, your hands must be washed or sanitized before wearing the mask. The mask should be placed properly. The mask should be worn properly, and the mask should be removed properly. And I'm going to demonstrate that to you today. Also, we cannot emphasize enough the fact that you must continuously wash your hands. This way, you will prevent bringing in viruses to your face, to the eyes, to the nose, and to the mouth. So, the first thing I'm going to do, because I'm going to put on my mask, I am going to sanitize my hand. I do not have any water and soap here, but I do have my hand sanitizer. So I'm going to put at least a 25 cents piece amount, and I'm going to utilize the same procedure as if I was washing my hands. So I'm going to rub together back of my hands. I'm going to interlace. I'm going to do my knuckles, and I'm going to do that until it becomes dry. Then my thumb. I'm going to do my thumb. What I do to one hand, I'm doing to the other hand. Then I'm going to put my fingers together. I'm going to rub it inside of my palm to ensure the tips of my fingers and under my nails. What I do to one side, I'm going to do to the other side. And then I'm going to take it down to my wrist area. Okay? Alright. So now you notice my mask is sealed, so it's not on the desk, it's not in a tissue, it is sealed. Now, this is the mask. So with the two ends, if you notice those looking from the two ends are on the outside. So I'm going to take one side, clearly keeping the mask away from my face. I'm going to push it and put it behind. One, here. I'm going to take it across my face to the other side, right? Then there's a metal strip right at the top. So I'm going to secure the mask to my face, and then I'm going to extend the outer flap. Okay? And it is on. So this is how you wear the face mask. And for the duration of this, I am not going to be touching the face of my mask. I'm not going to move the mask and put it under my chin, nor am I going to put it above my forehead or hang it to the side of my face. If I do that, then my mask is contaminated and it should be discarded. Back to you, Miss Harry.
All right, thank you so much. Of course, for those of you who'd like to view what is happening, you can always log on to the Facebook page and the YouTube page of the Office of the Prime Minister, and you can, kind of rewind and look at that demonstration. And our thanks to Mrs. Shillingford for providing that demonstration. Mrs. Shillingford, of course, later on in the program, will come back to you with
Most
more
definitely.
discussion. I want to welcome for the first time on our program Ms. Leslie Ann Waldron. Good morning.
Good morning, Tina.
And, welcome to the program, and thank you for taking a little bit of your time, a little bit out of your day to join us, because we know that the public has had a lot of concerns about mental health of the general public, mental health of our frontliners. Everybody is concerned about that, simply because in times of disaster, we always think about protecting ourselves physically, but we always overlook the importance of mental health. So tell us, a pandemic like this, a disaster, we have to call it a disaster like this, what kind of effect can it have on an individual?
Okay, so for this situation, it's different from others where a selected group would be affected. With COVID-19, everyone is affected. And as you said, we speak a lot about the medical situations, physical, doing exercises, etc. But psychosocial support is very important, and taking care of our psychological health. Um, a lot of us may overlook it. We may think that we are doing okay and we're not even taking that extra moment to stop and think about it and identify how it is affecting us. But as I said before, we're all affected. There are, however, specific groups of people who may be affected more than others. Um, One of the first groups is the elderly. The elderly, a lot of times, even outside of this pandemic and when we have been encouraged to be physically distant and all of that, they are normally socially isolated. Not necessarily just physical, but socially isolated. They're not able to go out and do stuff for themselves. They depend on their family, their friends, their neighbors to come in and do stuff for them. So we can only imagine right now how much of a toll this is taking on them. They are not able to do it normally, and now the people who are normally doing it for them may not be able to be doing it as readily as they used to in the past. The elderly too, they're listening to the radio, they're listening to programs, their television is on CNN and on our local radio stations, but they may not be able to understand the medical jargons, the different terminology used. Imagine your grandparents listening and they're hearing of thousands of deaths in the US and how many cases and all of that. Just those general information causes increased anxiety for them. So what do we do as the younger people who they look to? Both the elderly and children, they actually feed on our cues. How we respond, how we react to certain situations, that's how they're going to respond. So if you have, Sheena, for example, you have some form of concern about something, let's not overly react in the presence of your grandparents. Let's get that information to them, but in a more, in layman's terms. Let's break it down to their level.
Right.
Sometimes you may even have to extract some information or prevent them from knowing certain things. We need to keep them mentally safe. We need to keep them psychologically stable. How do we help them if we can't go to their homes? We give them a call. Our family members, even those abroad who are going through the same conditions, they call and let them know they are okay, because they may be wondering how my family members or my children overseas are doing. So we give them those calls. In terms of the community groups, we have local government, we have the Council for the Aging. I know they do a very good job. We have their numbers. Can we just call and say, I'm checking up on you?
Right.
They actually appreciate those things. A lot of times they may not be able to use the social media that we do and send a text and so, but just a little call. A neighbor, you stand on your porch and you shout out across, how are things? Are you okay? They feel better. They're also very concerned about getting their medication, about the normal help that they would get from the community health aides and the people who come to visit them. Now, they know just as we do that our health system is right now extremely burdened by dealing with this, by doing all the contact tracing, etc. So we need to help them with those situations, reassure them that things will get back. We may not know when, we cannot give them any false hope, but we need to let them know that everything will be okay, and at least we are there for them. A lot of our elderly also have some of these underlying conditions which make them more susceptible to other conditions if they had to be contracted with COVID-19. So we need to also keep them safe, make sure that they take their medication, they follow the regular regimens.
Right.
So another very important group, the children. As I said, children feed on our verbal cues, our body language. If mommy is anxious or seem to be panicking, we find daddy looking a little bit worried or concerned, the children will realize that in their behavior. They are not at school. In the beginning, it feels good. So it's like a longer
vacation,
weekend, a
right.
vacation. But now this vacation is going on for too long. And even now they're on Easter break, so they may not be doing the online school and all of that. Our children are concerned because for the first time they're out of school in April. Why are they out of school during that time? So we need to, in ways that they will understand, explain to them. Children can't express their psychological concerns as well as we do as adults.
Right.
They may not say that they feel stressed or they're concerned or they're depressed, they're feeling depressed. What they do, you see behavioral changes. So that child who was normally very jovial may become a recluse. Or we find your child who was normally well behaved and doing things, he is now seeking attention in other ways, doing things to get your attention. We find some children who have reached the age for potty training and all of that, we find they are wet in the bed now because they're extremely concerned and worried about what is going on. So they may even have physical changes in their patterns. So what do we need to do for these children? We make home a safe space. As best as we can, we need to make the home a safe space. And for those families who know, you're aware that your godchild lives in a home where the father is an alcoholic or maybe there's some history of sexual or physical abuse, look out for them. Maybe you have to find the best way to say it. Can I have my godchild to spend the weekend with me? Although we are promoting physical distancing, so you would have the specific factors that you take in place. But give them a call because normally they're at school, but now they're at home for longer periods. So that means they're more out there, more within, sorry, not out there, they're within the home for longer periods with those people who may be the abusers, with their parents, with the people who are supposed to be caring for them to be their abusers. So we need to look out for them. We need to keep a schedule. So during school time, they have a schedule. I'm sure over the past couple of weeks, we put things in place as to when they do their work, etc. Now that they are home, we need to ensure that we have certain things in place for them. And we've lacking to have a schedule. The parents will become overwhelmed. I've seen on social media, Mrs. Chillingford, parents are complaining about children eating so much. Without a schedule, they're going to eat. So we need to, there should be a snack time, a lunch time, have different things put in place for the children, and the parents follow suit. So if you're a parent working at home, you should therefore set the example and let them know mommy is in that specific space working and then she takes a break. But if you're just lying in bed, you're not doing anything, then the children follow upon that. So these are the first two groups I would like to speak about, the elderly and the children.
Good to know.
All right, thank you so much. Now, we spoke of elderly and children, but like I mentioned at the top of the program, the frontliners need also to be able to cope. And so, if as a frontliner, what would be your advice to me on how I can cope with the daily stresses, the anxiety that I face? Because I fear for myself and my family as well. You know, although I'm protecting others, but I have those very same concerns. Or perhaps I'm working in the ICU where someone, and I have to look, look at this patient suffering and I have to try and cope with that myself. What mechanisms can they use to cope?
In beginning, I would like to let the front liners or healthcare workers specifically know that you cannot pour from an empty jar. You have to ensure that you have what it is in you so that you can be able to help the people around you. Frontline workers a lot of times suffer from what we consider to be vicarious trauma or secondary trauma, where they're not the ones experiencing the immediate trauma itself, whether it's the illness or whatever it is, death, etc. But through the people that they're helping, you're constantly in that situation, in that area, seeing people crying, seeing people suffering, and then you put yourself in their position and you have that vicarious trauma. We need to be self-aware as frontline workers. So you need to know when you are feeling different. Constantly stop and do the introspection. Today, I do not feel like going in. I'm going in, but I'm normally the person who's up and ready, and I'm a morning person and all of that. But today I find myself a little slower and I'm making excuses and I'm stupid and I'm irritable. So we need to do that introspection. But then a lot of times we are not able to do it, or we are even too busy to do it. And the truth is we spend more time at work than at home,
Right.
or more of our wake hours at work than at home. So that's where our bodies come in. I realized coming in, Sheena and Mrs. Shiniford, they all have a nice little rapport. And that is good because your workspace is supposed to be safe. So we come in and, Mrs. Shiniford, you're not looking yourself this morning. You need to do that, to look out for each other. Be able to have those conversations. Volunteer, tomorrow I'm going to bring snacks. So at least that is something that you're not going to worry about. Make it easy to talk. Maybe not during the regular working time, you're not able to talk at that time, but find a little time to have that conversation. Look at things outside of the news about the pandemic.
Right.
Let's zone out about it for a little while. So maybe you want to set specific standards. I'm going to look at it a certain time during the day. At night, I will spend half an hour flip through the news, but I'm not going to be overburdened or overwhelmed by that information. When you go home, so we're saying that the healthcare workers, we're looking out for each other, making your workspace a safe space, doing the introspection. But when you go home to, you have a family that you're going home to, you are overburdened with guilt. Here it is, my partner, or if it's my mother, my cousin, whoever it is, have been spending so much time with my children and I am not able to be there.
Yes.
So let's try to have that conversation with them, you know. So talking is important. I tell people all the time, let's try to take a vacation daily. And I remember the last time I told that to someone, they said, how do you mean? Where am I getting all that money? A daily vacation is doing something different for a short period during the day. So you spend more time in the shower. You normally jump in and in 5-10 minutes you're out.
Yeah.
No, I'm going to let that water run on me for a while. Or my daily vacation is in the vehicle outside the house.
Right.
Whenever I get home, I remain in the vehicle for a little while where I have just my little time by myself, because you go in and you're starting to deal with family and deal with everybody else. So try to do something. Within the curfew hours, you go for a walk, you just spend some time on your own, and that time is reflective. So for the frontline workers, we are saying it is very important to take care of yourself, take care of your mind, because you cannot pour from an empty jar.
Definitely.
Ms. Harry, I just want to say that I can identify with what Ms. Walden is saying. I don't know if you remember, Ms. Harry, sometime week before. I think that was my exact situation where I felt that I just was having a break. That I just, I just needed to just pause.
Did you
know?
feel guilty for pausing?
When I woke up, because I took a sleep vacation. I never sleep in the day, and that day I slept for 4 hours.
Wow.
And I just felt My body changed. I just felt very irritable. I just felt that I couldn't think and concentrate. And I just had to call my supervisor and say, I need a break, you know. And I went home. The house was empty, and I slept for 4 hours straight. I mean, that is like a miracle for me to sleep during the day, you know. And when I got up, I mean, I was ready to go
You were
again.
rejuvenated.
You know,
yes.
yes, I was like, boy, that is what can happen to you. And I have been going and going and going and with this busy, energize your body, bunny, and you know, until and just like that, it just happened. And then, you know, so I can tell you, I can identify that. And, you know, that vacation for me was sleep.
Yes.
And
You know?
one of the things that you said, which is important, is you were able to call your supervisor and said, I cannot.
Yes.
And we need to, as I said, look out for each other in that way. Have that conversation. You know, I am not feeling well. I am not able to come. Or I can come, but I'm going to come a little later.
Yes.
I'm going to delay whatever task I needed to do. So we need to communication. That is very important more than anything else right now, to let people know how you feel. And it is okay to just send out a little message. So there's this nurse, this doctor, this community aide, somebody who you know, and your mind came on them, or you just even try to make it as a daily practice. You know what, I'm going to just send a message thinking of you. How are you doing? And what I realized when I ask that, how are you doing, sometimes I want to retract that statement because I get a long. But
Yes,
sometimes
yes.
you may not even need to respond, because just writing it out or saying it out helps the person. Because we may not realize that's how we were doing until somebody asks, how are you doing?
Now that Mrs. Shillington mentioned, you know, how she has affected physical. One of the things I always stress to people is that anxiety and stress, it manifests itself physically.
Yes.
You know, it's a mental thing, but you feel it in your entire body.
Yep.
Simply, okay, for instance, we have this COVID-19 pandemic going around, and people are anxious about it. All of a sudden, everybody fruit scratching them.
Yes.
You know, even if that might not necessarily be a symptom, but your fruit scratching you all of a sudden. And all of a sudden, you show every day you have a fever, you know, or you feel so exhausted that you don't think you can lift another finger, like Mrs. Shillington was saying, that she needed that sleep. So that anxiety, that panic, that worry, it manifests itself physically. And we have to pay attention, like you said, Leslie, to those signs,
Yes,
so that we can take that necessary break, right? And also, you know, you were talking about asking people how they're doing. One of the things as well is about sharing only negative information.
Oh.
That helps nobody's mental
And
state.
wrong information.
Negative and wrong. You know, a
Correct.
lot of times, yes, you want to share, but you have to ask yourself, what is that doing? How is that affecting the nurse who's working on the front line, or the doctor who's working on the front line, or the social worker who's on the front line, the fireman? What impact is that having on their mental state? If all I keep sending them is this video of negativity, is a constant cycle of negativity. We don't send the things where, okay, 100,000 people have recovered, way to go nurse, you know, good job. But we send the negative. What kind of impact would that have on someone?
Yeah, obviously, as you're saying, that it is going to have a negative psychological impact on you if you are just listening to the bad things which are happening. So, for example, I believe in the beginning of this week we had from Health Information Unit the information, the data on the number of cases and all of that. But right at the bottom, there was the information that we have one person recovered. And nobody pays attention to that. I'm not even sure if they're seeing it. We need to pay attention to the fact that there is recovery.
Yes.
And not everyone, and even in our country, that we are saying we have had a number of cases, but every time we hear the reports, they're doing well, they're coping, they're not on ventilators, etc.
Yeah.
So these things should be helping. And just listening and sharing information with the daily statistics. I had asked one of my contacts the other day, are you an epidemiologist? What is it? Like, you are constantly posting statistics about how many people are dying, how many cases worldwide. What are you trying to achieve? So we need to focus on the fact that, yes, this is bad. We're not running away from the fact that this is bad, and we are all having some negative impact by it. But let's focus on, yes, there are some good things about it.
Yeah, a number of good things.
Yeah, a
Very
number
true.
of good things. Yeah.
Now, before Mr. Shillington, we're coming to you shortly, but let me just ask Leslie one other question. coping, we talk about coping mechanisms, but as far as the psychological society is concerned, or even the psychological unit at the hospital, what kind of services can you provide to people? If someone is saying, I'm such, I need to talk to somebody, I need somebody to listen, I need advice, are there services available for these people?
Well, I know that the psychiatric unit, they provide that type of support for people. There are different clinic days. There are the people who are known psychiatric patients who would be followed up by the community mental health team. Um, Also, the Psychological Society has a hotline, so they could also tap into that. There are different institutions. I know St. Alexander works with Lifeline and Red Cross, so they're different. But there's also what we call psychosocial first aid, which does not necessarily have to be provided by psychological professionals. So we could have the community leaders, the group leaders, village council, church leaders, different people can provide that type of support. So it doesn't necessarily have to come from this official or professional source, but just the daily we checking up on each other. And then it would be referred to a professional if you realize maybe the person is not coping well and it's beyond your capacity. But I don't think we're at the point where people are necessarily needing specific specialized services. And if you have to look at different mediums, they are needing what we are looking at as psychological first aid, which we can provide within a community or home setting.
Definitely. All right, so it's just about finding someone you can trust.
Finding someone.
Very well. All right, thank you so much. We're going to open the lines in just a little bit for your questions and comments. So I hope you're writing them down so you don't forget. But before that, let's get to Mrs. Chillingford. Mrs. Chillingford, one of your primary roles so far has been preventative. It has been educational sessions, educational material on how to protect yourself. So tell again, people say we repeat. Yes, we repeat. We like parrot. We just repeating and that is because we want that information to get across. So let's go to you now and speak a little bit on the preventative measures. How can we care for our physical self?
Okay. So one we spoke about the last time, we spoke about having a family plan, and I want to get back to that. Every institution, every family, every household should have their family plan. The plan headed, how do I keep COVID-19 out of my home? Yes, you can head it that. What does it involve? It involves things like, one, ensuring that every single occupant of the house, whether it's your family, your friend, knows what the plan is, what they are supposed to do, and their roles and responsibilities. One of the first things is in terms of the clothing that you wear when you leave your house. Okay? Your shoes, it should be left outside. Your first level of clothing, layer of clothing that you come in should not move all the way into your home. So one of the simplest things you can do, either if it's downstairs or as you just enter your house, you can have your clothes basket, a plastic bag in there, and as you get into the house, you step in, you remove the first layer of your clothing and you put it into this bin in the plastic and tie. From there, before you make any contact with any surfaces of anything in the house or with your family, you move directly to the bathroom and you wash your hands. And you wash your hands and you wash your hands with soap and water. Some people may choose after that to remove their second layer of clothing and then go directly to the shower. Nice warm shower. I mean, I love to bathe. I mean, you can do that as well. Okay, so that way you're not taking anything on your clothing, on your body, to your family. Okay? No. We do not wear clothes over. So, before you'd have that nice jeans pants that you maybe wear 3 times or so before washing it. This is not normal times. We are in a war. Okay? So you cannot wear the jeans 3 times. All clothing, first layer of clothing, 1-time use. Okay, so you don't leaving it outside to air. Better safe than sorry. You take them out and you put them in a bin. The other thing you can do is in terms of visitors to your home. So yes, you have restricted significantly, visitors, but sometimes there might be someone who need to come in to your home. So for instance, maybe a seater, right? If you have your essential service, you have to be working. You have to put something in place that any visitor that comes, that the directive is that, and everybody does it, as they enter your home, they go straight to the bathroom to wash their hands. You don't allow them to go all over if it's just a normal visitor, all over and touch everything in their home. You identify a specific seat for visitors, so everyone knows this is the visitor's seat. That way you can control what, where the person sits, what the person do, and the cleaning process. So after the person leaves, everyone know that this seat has to be sanitized. Spray with your little alcohol, clean with your bleach, and then put it out in the sun. You know? Because we know sometimes when we would have visitors to our home, they would go and they would touch and they would interact, but we do not want that to happen. We do not want them to be all over, and we do not know where they have made contact with the spaces. Another thing, I've seen certain persons out every day to do grocery shopping. Every single day. Before I come to the office, and I'm in the office every day, I take a drive around to the different supermarket areas and just look to see what is happening in terms of that social distance. In fact, it's more of a physical distancing that we are talking about. 6 feet away. That isn't so difficult to save a life, is it? My people, I have been looking at this. And some persons, every time I pass, I see them outside in the line. Okay? What is the purpose of this? As part of your family plan, you make a list of all of the supplies and the necessities that you need for your home, at least for once a week. And then one person is identified, the one we consider to be the most healthy or less at risk to go out to do those errands. Okay, so you need not have to go to town every day. One day for rice and potatoes, the next day for chicken and lentils. You know, make your list and just put down all of the things that you need. At least you know the number of persons in your family and how fast they are being used up. And then you can make that list, Miss Harry. And then you can go one time. One of the other things is that this is a war. So we are having a health disaster. So just like during the hurricane season, that you have your disaster box and your disaster kits. Then you too should prepare your disaster box and your disaster kit with all of the things that we normally put. So a person with the chronic diseases, asthma, diabetes, high blood pressure, whatever it is, ensure that you have your medication. Ensure that you have an additional month supply. Ensure that you continue to eat the way that you were supposed to for your conditions. Because this COVID-19, if you are diabetic, it's not a life sentence, to just die one time.
Right.
If it is managed, you're healthy, you understand? You will be okay. And if you boost your immunity by eating the right foods, vegetables, vitamin C, minerals, vitamin E, right? That you get in your green leafy vegetables, like your spinach and your lettuce and your kale and your cucumbers. When you peel it, you do not peel out all the skin. That is where you get your vitamin E, and they are immune boosters. You notice I didn't tell you broccoli or asparagus, all of the different greens, leafy vegetables that we have here. You can get them. Let's talk about things like probiotics that help with gut immunity, that helps the immune system in the gut. Okay? So you get it in yogurt. So so we want you to boost yourself. We want you to make your family plan. And of course, I've not exhausted all of the things in the family plan. There are other things that you can include to keep your family safe.
All right, thank you so much. So as you heard, the focus is on the family plan because it starts at home. Like we say, yes, the medical professionals can help you. They can do this for you. They can do that. But it starts with you in your home and you taking on the responsibility of protecting yourself and your family. So that's where the family plan comes in. Let's open up the phone lines because we'd like to give the public a chance to ask some questions. The numbers to call, 1-800-327-448-2484, 616-1327, and of course the overseas line at 305-432-9744. We're opening up the lines for questions. If you have a question for Leslie and Waldron on mental health and psychological health, then give us a call. If you have a question for Mrs. Shillingford from the Health Promotion Unit, you may do so as well. Mrs. Shillingford, while we wait, before we take our callers, let's talk a little more about preventative measures. Let's talk a little bit more about things like respiratory etiquette, or even hand washing and things like that. That people always say, but I know how to do that. I don't need nobody to tell me how to cough and how to wash my hands.
Okay.
That is not really a fact because we've observed that ourselves.
So, Miss Harry, just before I go to those areas, there's something I've noticed since a lot of people have been home, from work, working from home. I notice a lot of more persons have been burning garbage, burning bush, and burning things around their home because, of course, they are home and they think that there are things that need to be
So
done,
doing spring cleaning and
yes, around their home. But we also have to be mindful that our asthmatics are home. Our persons who suffer with respiratory conditions are home. Bronchitis persons are home. So sometimes when you would take a chance and try to do some burning, which we do not promote, that these people would have been at school or at work, or somewhere, but they are home, you know. So I've been seeing a lot of, burning of garbage. I want you to stop it. Remember, we can do a lot of composites, use compose and put them, in the soil and use as nutrition for our plants and food. Okay, so please, please stop burning the garbage. Stop burning rubbish. The smoke is not good for people like that. You're compromising them even more. If they get sick from the smoke, that means they need to go to the accident and emergency department, increasing their risk to being outside. Okay, so the public, please stop the burning. Okay, so since we've talked about that, and I know our population going to listen, and we're not going to be hearing calls of persons getting suffocated or asthmatic attacks because the neighbor is burning rubbish or the coal pit is on fire, in stock farm. We need to, you need to really, work on that. We have to look at the other people, we look at the children, and our elderly too are very much indoors. Okay? So let's go back to hand hygiene. We cannot keep staying. Any call on the line? We are okay.
All right, let's stop you just for a little bit and take this caller. Caller, you're live. Go right ahead.
Hello, good morning.
Hi, good morning, caller.
I'm Georgina from Michelle. I'm so happy to hear these talks, especially when Mr. Stewart said we have to take time for ourselves. Vacation. Vacation is what really, she's right. To have money to take a plane or a boat. What you said, especially about the sleep, is true. When you take time for it, especially if you need to sleep. And like she said, when you finish take that sleep, you feel new again. You can even mash up the house. Yes, so I was so happy to hear that. And I see you all are doing a very, very good job. I was really thinking like if you didn't have your recovery. And this morning when I heard about one, I am so happy for that. We have to think of that. Not to thinking only that it have another one or three again or four again. No. We got to pray that they have recovery. Continue to do the good job. I'm telling you. Have a good day.
Thank you so much, caller. You as well. All right, do we have another caller on the line? Okay, so the lines are open. If you'd like to ask a question or make a comment, you feel free to do so. Mrs. Trinidad, sorry for tripping you earlier, but go right ahead. You were talking about hand hygiene and hand washing.
So we keep saying it. Wash your hands. Wash your hands. We have also given you times that we know that we should definitely wash your hands. But now we are saying, just wash your hands. Wash your hand, and that's the only way you can make it habit forming. If you do it continuously. If you just go under the pipe and you move your hands together under the water without any soap, it's not considered a hand wash. Okay? For your hands to be washed properly or to be considered that you wash your hand, it must be done with soap and water or a sanitizer 70% and above alcohol. Okay? So wash your hands. Wash your hands. And I remembered, in the years gone by when we would have flu season, outbreak of flu after the carnival season that we normally name, and we would go to the different daycares and preschools. We would just have the children saying, wash your hands, wash your hands, wash your hands, wash your hands, wash your hands. Because, it just stays in your mind that every time you enter a bathroom, that it says, the first thing, wash your hands. You understand? And one of the things we are also promoting is that you wash your hands before you use the washroom and after you use the washroom. So a lot of times persons come in to use the washroom and they do not wash their hands. But remember the process from where you move to enter the washroom, so many times you touch surfaces, and now you're going to use that hand, to touch your private parts, to touch your face, please wash your hands. One of the groups that I'm concerned about in terms of the population are our persons with disabilities, Miss Waldron. And we know by the virtue that some of them may have these physical disabilities, the likelihood for them to touch rails, hold on to rails and doors and those things increase significantly. You understand? So in terms of their risk, because they always touching rails. So we are asking business places, those supermarkets, and these businesses that have remained open. I am very happy for it. But we want to encourage you, to continuously cleaning these surfaces. So the rails, the handles, the doorknobs, anywhere that these persons may need to hold on. We are also saying again to the different community groups, so the church groups, the council of aging groups, the faith-based groups, local government, these are the time for you to assist health. Assist health with the population. The demands are great. Give them a call. Find out if they have anything that they need to do. Of course, you can do it and do it from safe distancing. So you take it and you put it on the porch for them. If they have to pay you, they put the money on the porch. You leave it and they will come for it after. Of course, we also want them to disinfect, all forms of groceries or anything coming from out of the house. So yes, you can make a spray bottle. You can put some alcohol in there. Okay, and you can spray whatever bag or whatever contents that come from outside. You can also exercise washing your hands with the normal soap and water.
Right.
Because what we have noticed also too, that a number of grocery stores and employees in America and the other countries are coming down with COVID-19. Okay, so we are empowering the population. Anything that you bring into your homes, that you ensure that you disinfect them, you spray them, you clean them, you wash your hands. And these are things that we have promoted all the time in terms of washing of cans and things like that. Right?
Yeah.
Okay, so, our persons with disabilities, yes, community leaders, community groups, we are not saying that you're going to put yourself in harm's way. Identify persons, the people in your communities, identify them, call them, find out what is happening, empower their families to get on board and identify who's going to deal with these people here. And of course, please, and I'm encouraging all our these different business entities to wash, to clean their areas. And what are the solutions, Sheena? 70% and above alcohol, bleach. Yes, the cheap bleach. We use that for everything, all household. Now they are saying you can put a little bleach in your dishwashing liquid. I think all the Americans doing that
Already.
Yes. You understand?
If
So
only to stretch it.
yes. Okay. So you clean. Use your bleach. Of course, you can use in terms of a ratio of about 10 ounces to 1 gallon of bleach. And you use your bleach. You clean the surfaces. And if you can afford Lysol, all the different types, the wipes, the sprays, all of that, use them. If you're coughing, no color yet, I think we're hitting the nail on the head today. So if you have the flu or cough or sneeze, we know we are not coughing into our hands. What we promote the most is coughing to a tissue. And when you cough into your tissue, you ensure that it totally covers your nose and your mouth. This tissue should be a one-time use. Okay, so you cough or sneeze into it, you close it, you discard it in a closed bin, and then you wash your hands. And we have been saying sometimes the sneeze or cough could come when you may be on a bus or in the office. Although we are saying that if you have a flu-like symptom, you should be home. Okay? So you can walk with a Ziploc bag or a bread bag. We normally collect those bread bags at our home. We have a drawer full. Take a bag, put it in your bag, your ladies' bag. Men now using their haversacks. Put it in your haversack. That if you use that tissue, you can simply put it in it and tie it, and as soon as you get to a receptacle, you can discard, and sanitize your hand.
Mr. Chemical, I want to take a step back a little bit when we were talking about hand washing and the importance. Some people are substituting hand washing with wearing gloves. We've noticed that being done a lot, especially in business places, where they will be wearing gloves and then they're touching everything. Why are we discouraging that?
Of course we are discouraging that. Because what it does, it offers a false sense of security. What happens? You wear gloves and your hand, whole wash is clean. There's no need to wash my hands. You're touching every single surface and you're transmitting viruses from one surface to another. And as we say in medical terms, contaminated to non-contaminated becomes contaminated. And sometimes you can actually see that glove physically dirty, So whole day I gloved up and I'm using this glove and I'm touching every surface, everything. No need to wash my hand, and also my hand in my eyes, and my hand in my nose, and my hand in my mouth. Because research has shown that the normal human person can touch their face up to around 300 times a day without even knowing. You know? So that means you have the glove, you're not washing your hand, inside your hand well safe, but you're touching everywhere, you're touching everything. So please, get rid of the glove and wash your hands. Now I can understand in terms of persons like cashiers and so in the supermarkets that you cannot wash your hand after every single client. But what you can do is to use the hand sanitizer. You can use the hand sanitizer 3 times, and then you must go and wash your hands. Okay? And why is that? When you put the hand sanitizer, one, if you notice it's a bit sticky, so you have that stickiness. Then you use it again. That means you're mixing and you're touching, you're mixing things together. And by the third time, you have a layer of thickness that the hands need to be washed. So it is rendered ineffective by then. Okay? So 3 hand sanitizers, and which has to be 70% and above, and then wash your hands.
All right, Mr. Shunikar, we have another caller on the line. Caller, you're live. Go ahead. Good day, caller. Go ahead.
Hi,
Good morning.
what you can do is to use the hand
Ah,
sanitizer. You can use the hand sanitizer
hi, Miss Movie.
and then you must wash. Okay? And why is that? One, look, sticky. You have that sticky there. Then you
All right, thank you so much.
okay, so in terms of persons with visual disability, we have since tried to contact 2 persons to come in to do a sign language um, demonstration. It has not been fruitful thus far. Miss Murphy, if you have somebody you can get to us now as a matter of urgency, could you assist us with that, please? Um, in terms of, what's the other question she asked? In terms of,
Providing masks.
no, we'll not be providing masks to, you know, but we are hoping through your association that you can, get some for your clients, because you will well understand that in terms of health, the needs of the healthcare workers, in terms of ensuring that they have sufficient to deal directly with the COVID-19. So yes, I can say that we have tried to get, we've got 2 numbers of persons who were trained, and we have called these persons and not been able to get through. So Ms. Murphy, if there's anyone that you know can work with us right away, I would gladly accept that now.
All right, thank you so much, Mrs. Jennifer. The phone lines are once again open. Just a few more minutes left in today's program. 448-3284, 1-800-327-616-1327, or the overseas line 305-432-9744. So back to you, Mrs. Shillingford. We're talking preventative. We're talking, what can we do to protect ourselves. But for those people who are feeling ill, who might feel like there's something, a genuine concern, what can they do? Who can they call? How can they reach out?
Of course, that's our hotline. Our hotline numbers to call. It's 24/7, and I guarantee that if you call, for the hundreds of persons who have called the hotline and successfully gotten through and number 611-34-344-4325. Thank you very much, Miss Harry.
Yeah, I'm the behind the scenes.
Sign language.
Okay,
Yes.
so of course the hotline is there. If you are experiencing any signs and symptoms or flu-like symptoms, we want you to call the hotline. And of course, we'll ask a few things from you, and then we'll direct the necessary team to address your situation.
All right, thank you so much. We have another Caller on the line. Caller. Okay, we've lost that caller. Caller, try us again. Again, just a few more minutes left. Let's get back to you again, Miss Waldron. While as we're wrapping up today's program, any final comments, any final words for the people? How do you encourage people to stay mentally, psychologically healthy? Just a few final remarks from you.
Okay. Firstly, I'd like people to know that the feelings of anxiety and the depressed mood, it is normal at this time. It is very normal how you are feeling. It is very real. And one of the things I like to encourage is that people do not compare their feelings with that of others. How I feel about a situation is how I feel. If Mrs. Chillingford is less overwhelmed or she's more optimistic, that is up to her. But I feel that way. What we do, though, is provide that information that could help the person in feeling better. So we are looking at being there for each other. Social support is very important. And we may be asking, how am I encouraging social support in a time like this when we're not supposed to be with each other? Well, according to the World Health Organization, and I know everybody's talking about social distancing, the World Health Organization is saying it is physical distancing. So we're actually distantly socializing.
Correct.
So the WhatsApp people used to say that had us being very anti-social before, right? Right now we're encouraging those things. So let's be there for each other. Let's socialize with each other. Let's look out for each other. Do just as Mrs. Chilford spoke about the healthy eating and the exercise. That does not only help with your physical health, it helps with your mental health. So we're encouraging the healthy eating, the exercise, the talking, the resting, doing those things, and knowing that it's okay because the social media is flooded with information, and they try to say that after this you should be a specific size, you should be exercising, you should pursue certain dreams and whatever it is. That is not true. You may have times where you just don't feel like doing anything. And after all, you're going through this situation. We could even relate it to grief, because a lot of times we relate grief to death, but grief is a psychological response to loss. So you lost your job, you lost your independence, you lost your normal way of life, your space, even that bus you used to ride on, and you developed a rapport with the bus driver. You're coming down in the morning, right? So people grieve, and we grieve in different ways. There are different stages of grief. So sometimes you hear people and they're ranting and they're upset and they're angry, and they just let people be, because that is their response, their emotional, their psychological response to what they are going through. So I'd like to end by letting you know that all of these feelings are normal. Please do not be too hard on yourselves. Provide that social support for each other. Seek help. It doesn't necessarily have to be professional help. Seek help from each other, and let's socialize distantly.
Very good. I just wanted to say something, at the same time where Miss Waldron was speaking, because another thing I've noticed is that some persons like me happy to be home. I love home. Home is where the heart is. But it may not be so for a number of persons. So that's why they spend most of their time at work or in the rum shop, as not a good coping mechanism, but as their coping mechanism nonetheless. Sitting on the blocks, playing dominoes, that type of thing. And now they have to stay home, which may not be a happy place. So I just want to, let people know that the situation is not the same for everyone. So right now, some persons may be having a real difficult time in staying home. So
even as we spoke about the alcohol too, alcohol use and drug use is a form of self-medicating, specifically for our men.
Yes.
So whereas the women will talk about it, they will rant, they will post statuses, etc. Men in our society, it's not encouraged for men to speak out like that, specifically about emotional stuff. So what do? They go down to the bar, they smoke a joint, they do whatever it is. So we need to encourage people that these methods are poor coping mechanisms, and the alcohol use that could actually help affect you in your physical health too.
Very true.
So just to end today, I just want to say, remember your water. Hydration is very significant. Hydration is significant in the fight for everything, since most of our body is made up of water. Okay? So it doesn't mean that you have to drink 6 to 8 to 10 glasses at one time. Get your bottle, pull it, and throughout the day, you sip your water. Keep hydrated. Okay, my people? So physical distancing. Please do not come down today every day to shop. Make a list and come one day in the week.
Okay, I feel like this caller has been trying to get through. So let's take this very last caller before we wrap up. Caller, you're live. Go ahead.
Hello, good morning.
Good morning, caller.
Good program.
Thank you.
I
Thank you.
understood that some people can be fed up when they sit in the home. But there's an artist who says in his song that home is where you're happy. But anyhow, we feel good. Okay? I don't know, I cannot remember the name of the artist, but that is a very good song. Okay, thank you.
Thank
You're
you.
welcome.
Thank you, caller. Have a good day. All right. I know there's so much more we could spend time talking about, but I know DBS probably want their studio back, and the other stations probably have programming they need to get back to. We want to thank Mrs. Shillingford from the Health Promotion Unit, coordinator of the Health Promotion Unit, and of course, Miss Leslie Ann Waldron for coming on today's program. I feel like I need to invite you both back because I know there's just so much more, and I'm sure the public has so many questions that they'd like answered, but time always escapes us when we're on the program. So thank you, ladies, again for joining us today. Thank you to all the listeners for joining us, the listeners of Q95, Voice of Life Radio, Kyrie FM, Vibes Radio, and of course DBS Radio. Thank you so much. All those who are viewing on the pages of the Office of the Prime Minister, we want to thank you for tuning in. And we invite you to tune in again to our next program. Of course, the long lockdown begins on Thursday evening at 6. This is the longest one we've had so far. It begins on Thursday at 6 and continues through Tuesday at 6 a.m. So we're begging and pleading and crying and any other word I can think of. Please adhere to the rules and regulations. It's a lockdown for a reason. And they say that the virus doesn't move, people move, and then the virus moves with them. So if you don't move, you stay home, you just follow the rules and regulations, because we don't want nobody getting arrested during a lockdown. That makes no sense. Because if you are at home, you would not get arrested during a lockdown. Stay home. Yes, it's Easter weekend, and we know everybody used to going on the beach and cooking up food and doing this. Do it in your yard. If you want to have a little, do it in your yard. Cook your food and sit in your yard. It's okay. Take some sunshine, do a little tanning, and stay in your yard. But we're asking people to let us protect each other, protect ourselves. It's the longest lockdown so far, but we don't want it to get worse, because there's always the option of it being worse. Because we all hear the stories, we all know what's happening, because we follow everything all over the place. So we know what's happening in other countries. So we know it could be worse. So those 3-4 days, let's just stay home. Stay in our yard. You need some sun, you need some air, go on your porch. Go in the backyard. But you can't be on the streets. Total lockdown all weekend. It's not okay, I can go at 6 o'clock, because none of that. From 6 p.m. Thursday until 6 a.m. Tuesday. Do not forget, that is no law. You have to stay home. All right, so we're encouraging that. So again, thank you everyone for tuning in, and we invite you to tune in next time to our program, COVID Health Discussion. And thank you to DBS Radio for always welcoming us in studio, and to all the other radio stations for the simulcast. We wish everybody a great afternoon. Thank you so much.